Good morning. I'm so happy to be able to be back in 2023.
Yes.
I am your host for this morning for Have Your Say, Diana Robertson, and our guest is Dr. Candace Robertson-James. Welcome.
Thank you. Thank you for having me today.
So, 2023.
Yes.
Can you give us an update? You've been with us before and all, but can you give us an update as to what you've been doing? You wear different hats, different capacities, but some of the things that you've been doing, and related to the Salle University as well. So.
Absolutely. So hello, everyone. I'm Candace Robertson-James. My background's in public health, and I am at Salle University. I chair the Department of Urban Public Health and Nutrition, and I also direct the undergraduate and graduate public health programs there. So I'm excited to be here with you today.
Great. So one of the things you always say in reference to public health is that public health impacts everything that we do, whether it's, education, criminal justice,
Absolutely.
Everything that we do. So can you give us a little example as to what you really mean when you say that?
Sure. So a little while ago, actually, there was a This Is Public Health campaign launched a few years ago. And I love the campaign because it asks people to go out and put stickers on things that represent public health. And literally you wind up putting stickers on everything, right? Mm-hmm. Because everything ultimately can impact our public health or our health of our populations, right? And so from thinking about the foods that we eat, of course, that has a direct impact on our health. The water that we drink, the how clean the water is, the air, the quality of the air that we breathe, the neighborhoods that we live in, even from the environmental things that we think about, the trash cans on the street so that we are able to get rid of the trash appropriately, everything in our system. When we wake up in the morning, I sometimes have my students go through an exercise and ask, what are all the things that you did today that engage the public health system, from waking up, from having toothpaste, right? Fluoridated toothpaste, from being able to use clean water when you went to the bathroom, right? You were secure that the water was safe, right? It wasn't full of pathogens. So you engage in, some people might have taken transportation system. That's also a part of our public health system. And so it really is engaging in all of those things, all of the parts of our communities that help us to be safe and help us to be healthy. So the things that we might typically think of, like food and our healthcare providers, but also our jobs, right, that are giving us income to be able to buy the things that we want to buy to keep us healthy, right? The communities, if we have paved sidewalks in our communities, right, that actually promotes walking. We have bike lanes that promotes people being active and not just being in cars and not just being sedentary. So actually how our communities are designed, all of those things really impact the health of populations.
Okay, that's a whole lot then.
It's a whole lot.
Okay, so in your capacity at LaSalle University, clearly you have working with students who will eventually be engaged or more engaged in the field of public health. So how would you tell your students, or before they even apply to LaSalle, what would you say to students who might want to prepare themselves to become involved in the field of public health? What would you suggest that they do as far as preparation?
Well, that's a great question, because before the pandemic, I would say many people did not really have an understanding of the field of public health as a discipline, right? After the pandemic, most people have heard public health as a phrase. Most people have heard of public health as a discipline, but I still honestly find that most students do not have a robust understanding of the field of public health. Most people in general do not have a robust understanding of the breadth and depth of all those things. The greatest thing I always tell all of my students is the greatest thing about public health is it encompasses so many different things, like I just described, from if you're interested in working in health promotion and prevention of, diseases or conditions like diabetes or hypertension, that could be public health. You could be interested in working on violence prevention. That's also public health. You could be in environmental health and really working on the environment, and that's public health. You could be working on community designs and urban planning, and that could be a part of public health. You can be working in media and communication and how we communicate to our populations, and that's also public health. And so the greatest things for students is that it's so broad, and it really there has something for everyone there. No matter what your interests are, what side of public health you're particularly drawn to, that's amazing. The hardest thing for public health is that it's almost anything, right? And so sometimes students like that one specific thing. Like when you say you're going to be a lawyer, they have an idea of what that means. Or if you say you're going to be a nurse, they have an idea of what that means. But the problem sometimes with public health is when they say they're going into public health, they don't necessarily have a specific image of what that means. Their parents, their families who are paying for their education may not have a specific image. Well, what does that mean? And how are you going to get a job? Because of course, that's what families and students are concerned about. And so I think the one thing is to release yourself a little bit of that, what does this mean and what specific job am I going to have? I think the great news is that the public health workforce is growing. And so there are lots of job opportunities. But yes, it is finding a good fit for you. It might be a little, take a little bit before you find that great fit. Find that health issue or that area of public health that you're particularly passionate about. And so I think for families to help support their students, and for students to give themselves that freedom. So it's great to participate in experiential opportunities like internships, taking advantage of classes that kind of immerse you in various experiences. So you get an idea. It is a practice-based field. So you want to get out there. You want to get out there in the community and nonprofit organizations and research and take advantage of other opportunities so you can really delve in, because many people only know what they see kind of on TV. They know maybe hospital administration and that side of public health, or maybe they know epidemiology because they've heard so much during COVID. But a lot of people still don't have any idea of so much that happens in public health.
So anyone who wanted to or thinks they want to pursue that field, so what should their commitment be, while they're trying to seek out the specific area of public health that they want to work with?
Yeah, I think it's giving themselves permission to try different things. And so sometimes an area that you think that you might be passionate about, you may not, right? And so you might think, you know what, I really want to work with asthma. I maybe have someone in my family who has asthma. A lot of times a lot of stories start like that. I have someone in my family that has X, Y, and Z condition and illness, and my grandmama had diabetes. I really want to work on diabetes prevention, right? And sometimes that happens, and that does continue. And sometimes you're like, you know what, actually, it's this thing over here, health policy. I'm really curious and really passionate about, or advocacy. And so I think giving yourself the opportunity to try things that you wouldn't otherwise try, take advantage of electives. And so I think, those elective opportunities, those courses that, again, extend your exposure to different content, things that you might not otherwise think of. Also, of course, in public health, it is really challenging for some people to think through that public health lens. And so public health lends itself towards health equity, right? We're trying to promote the health of all people, diverse populations, right? And so for some, it is stepping outside of the box that, they may have grown up with, or the thoughts or the ideologies that they may have grown up with, and to think holistically, to honor communities and the diversity within our communities. And so it's both the topics and the issues as well as the population. So for some people, they're not as, committed, if you will, to a specific topic, but they really love working with a specific group, right? And so they really love teens, they are all about adolescent health, and they, run prevention programs in schools perhaps, or things of that nature, or they're really interested in working with seniors, right? And so they may be working and running programs and engaging seniors. And so for some people, they love the population specific work. Other people find their passion in the topics. But I think it really is committing yourself to go outside the classroom. A lot of times we have a lot of, like I said, experiential opportunities, opportunities to go to presentations and talks and just get out there. And sometimes that's hard because, students are working and doing lots of things and they're just like, let me get my courses and go home. But I think you really find that opportunity through networking, through engagement, mentorship, just taking advantage of every opportunity, partnering with faculty on research, again, volunteering, interning, all of those things really help to prepare you and help to give you expertise and exposure in those areas that you may be interested in.
Okay. So do you find that there are any misconceptions or maybe routine misconceptions by some students?
Certainly. A lot of people don't really still understand what public health is. And so they tend to have a pretty narrow perspective of public health. And so some people, it just depends on what they've seen. So they still think a lot of healthcare, right? And so they still think of healthcare, and it's just sort of, caring for people in a different way, in a non-clinical way. And certainly there are public health practitioners that work in clinical settings for sure, but there's so many other settings that people could work in. So that's definitely a misconception. I think one of the most common things I hear from students after a traditional public health 101 course is, wow, like I had no idea public health could really cover so many topics, that we're talking about housing, and we're talking about, urban planning, and we're talking about, adolescent health and schools and education and all of these different things in public health. So that is a little bit, usually surprising to most students, that they're thinking, we're just going to talk about healthcare system. People should be going in to see their clinicians. These are the recommendations that we should be telling people. But really, again, we talk so much about the social determinants of health. These are the things that influence us. These are the things that have the greatest influence on us, right? The communities that we live in, the houses that we live in, the spaces, our food environments, our work environments, our school environments. And so we spend a lot of time talking about all of those different things. And I think those are some of the most surprising things and misconceptions. People are usually surprised, and very consistently I hear after our classes, wow, I had no idea to be talking about all these things. Even things like discrimination and inequity and racism and all the isms. And so, people are just sometimes really surprised about that.
Okay. So just to switch up a little bit.
Yes.
So 3 years ago, you published a book, Reflections of Me.
I did.
And so what inspired you to write this book?
Yes, so I did the Reflections of Me book. Yes, I was inspired to write this book really based off of my dissertation research. My research was really engaging Black women to really understand their experiences with racism and sexism, and to understand how those specific experiences ultimately influence their healthcare practices and health belief systems. And really what I found in the midst of that research is that so many women talked about the messages that they received as young children, as young girls. And while we know that there can be negative messages around, beauty for women at large, that girls at large receive and internalize, those messages specifically for the women who I participated in my study really talked about not only how those messages were harmful at a societal level, but how those messages a lot of times are unconsciously really reinforced within our family systems. And so they're also hearing it within their family, as well as they're hearing it and feeling that pressure for a specific set of images externally as well. And so after I finished the research, I really wanted to do something to honor their deepest desires, which was to kind of speak to the girls within them, to speak, to provide those messages to young girls so that they didn't have to wait and go through so much before they really try to see themselves as beautiful, see themselves as powerful. And so this book really seeks to promote a positive self-concept in all children, of course, but specifically for girls and specifically for girls of color. But it really is a message, I think, that transcends everyone. And I am grateful that it has been well received by so many diverse audiences, including boys. And so this is, again, it's a message that I think is so needed and so important for people to be their own superhero, for people to love themselves and love their gifts and talents and everything that makes them them, and to see themselves as unique beings that have a positive contribution to make to their world. And not so much as trying to be like someone else or trying to conform or fit in, but to love themselves and to own their own beauty and however that looks. And so it really not only inspires that, but it also has a guide, some questions in the back of it. So parents or aunties or uncles can also engage in these conversations with young girls, because one of the things we also found is that although girls are sometimes thinking so many things, struggling with so many things, their parents are often not necessarily sure how to engage with, or don't necessarily in the busy routine, day to day, don't have the opportunity to engage in these conversations with their daughters or nieces or, cousins, et cetera. And so it provides some great questions to kind of start you on your way to provide to talk with your loved ones about some of these issues.
Okay. So, and since writing the book, what else has evolved in your desire to provide this message as well?
Yeah. So one of the great things is, like I was just saying with the discussion guide, one of the things that I wanted to do with this book is have it really be a launch pad for programming. And so while the guide at the back of the book could be great for parents to engage in discussions with their children after reading the book, but I also wanted it to provide activities and platforms, workshops, experiences where I could engage, mothers and daughters, or, ultimately the whole family system, and create a programming where they can come together and, we can model these things. We could have facilitated, fun activities and exercises that also allow families to have these conversations so that, in a safe space, we could help people really have some of these conversations. And so I'm looking forward to launching some of those programs. And what I've done so far, last year, I was able to start the ROM Mom Squad. So that's the Reflections of Me Mom Squad. And that's just a virtual discussion group. It's a space where mothers can come together, specifically mothers parenting daughters of color, to talk about some of the things that everyone's wondering about or struggling with and feeling maybe isolated. And they can come together in that shared community to realize, oh, wait, my daughter is going through the same thing, or I had that same conversation with my daughter just last week. And so we can support one another. We can encourage one another. We can share, build each other up, and just help us to be the best moms that we can be. So we're just about to kick off this week, actually, our 2023 series. And so we have some great guest speakers lined up. We're just looking forward to just great discussions with our moms. And also we'll have some sessions where we'll open it up for all moms, so not just moms of daughters. And so stay tuned to hear about some of those. We have some great topics that our moms have been wanting to discuss. And so we have some speakers that are bringing in to help us discuss some of these things and think more broadly, break us out of our own boxes so that we can excel. And then we also will have a mom-daughter event that we're going to launch as well to, again, really help to provide safe spaces, to enhance community and connection between the families and within the families, and then to provide opportunities for that important conversation and discussion. And you can also follow me on Instagram at Reflections of Me book. And actually, what we're going to be having, I'm just actually also launching a new umbrella organization, which is called the Ruach Lab. And so actually, I'm just about to switch over my social media to Ruach Lab. So as you follow me, probably when you're viewing this on Instagram, you can actually follow me at the Ruach Lab. And so that's at RUACHLAB at Ruach Lab. And Ruach is, means the wind or the breath of God. And this is really just to be God-inspired spaces where people can just dream and ultimately be the people who they were destined to be.
Okay, great. Sounds great. So this coming weekend, we celebrate the birthday of Dr. Martin Luther King. And his birthday is actually January the 15th. And so we will be celebrating that in schools and everybody as an official holiday that's been created. But in this celebration, I'm always concerned as to are we really doing enough to celebrate the legacy of Dr. Martin Luther King? And what is your feeling about that? That it's, to be more than one day, even though that's what we acknowledge. But are we doing enough to really celebrate the legacy of Dr. Martin Luther King?
Well, that's certainly a great question as we approach the celebration of Dr. King. And so I think that, on one hand, we've done a lot as far as having a national day where it is acknowledged and people across, everywhere, geography, diverse groups acknowledge Dr. King and can take pause and, opportunities for children to learn. Are we doing enough? I think that we could certainly be doing lots more. And so I think we have to be careful and break ourselves out of our own routinity of saying like every, this holiday, I'm going to do X, Y, and Z, and then, just do it. For some people, it's a needed day off. For some people who are working so hard and have services their entire life, for some people, they're like, I need a day off. And that's an important thing to take care of themselves. Of course, for a lot of people, it's a day of service. Where they can engage in different acts of service. But I think that the point for so many holidays, for so many things, is to acknowledge that, Dr. Martin Luther King, he didn't get to where he got alone. And so there's so much education and so much learning that needs to be done about so many of our ancestors and foremothers and fathers who came before us and worked so hard for us to have the lives that we have now. And so I think there needs to be a better, commitment to education beyond just Dr. Martin Luther King Jr. and the work that he was so pivotal, the change that he was so pivotal in making. But I think teaching about movements and, I'm just always so inspired by the youth that were leading those movements, that were actively engaged in those movements. And so I think there's a lot of opportunities for young people to really understand, what are the things that they're passionate about now in 2023? What are the things that they'd like to see different? And how can they learn from the past and the movements of the past? And how can we as educators, as community activists, as faith communities, social communities, etc., better engage ourselves, one another, and young people, young adults, children in movements. And so I think we could just do so much. There's still so much inequity and so much that needs to be done. And so we could look at it as an opportunity to not only, celebrate, acknowledge, but to really take a good look at where we are and the gaps that we still have and the areas that are within our reach to advocate for, to become more engaged in. Look at the communities around you that are suffering, right? Look at the organizations that are struggling and are in desperate need of volunteers. So rather than that one day commitment, could you make a once a week commitment or a once a month commitment at a local organization? Or could you volunteer your time, to provide tutoring services or to just find something that this one day is a spark, it's a beginning, but not a check off, I'm done for the year until next year this time.
Right. So as our time is winding down, are there any last words you would like to give as a something for everybody to think about. As you know, like I said, we're starting off 2023. So as they go through the year, there are some things that you would like to express that people are cognizant of and just constantly think about.
Yes, well, during this time of year, people are often setting resolutions, looking at goals, and really trying to maybe even vision cast a little bit about what they're hopeful for. I think the greatness of January is that people are hopeful. A lot of people, not everyone, of course.
Right.
People are hopeful that maybe something will be new, but it's not magic. I always say there's nothing magical that happens when we go from 11:59 on December 31st
right.
to 12 o'clock on January 1st. There's nothing magical that happens, but our perspective may shift, and hopefully we can allow our perspectives to shift and to really, I think, invest in ourselves. I was sharing recently, anyone who knows me knows I love Hawaii. I love the culture. I love this perspective of really enjoying life. And I would want people to really take this year and to think about how they can enjoy life, how they can enjoy themselves, how they can do their mental health and wellness checkup, make sure that they're okay, checking on those around you. People are struggling, people are crashing. There's a lot of depression, anxiety, and lots of other mental health or mental illnesses that are really pervasive in our society. And so we need to check in. We need to check in on our physical health side. We need to invest in ourselves. We need to take a moment and find what fuels us and what we enjoy, care for our family and friends, and just take advantage of enjoying life. So I would want people to invest in themselves this year.
Okay, great. Well, as always, you provided us with a lot of information and food for thought. And so, once again, we're glad to have you as our first guest of the year. So,
Thank you.
So we're really happy about that. And so now, as we're winding up, just want to remind our listeners that Dr. Martin Luther King Jr., as a civil rights activist, he used his voice to speak to the social ills and social injustices of this country. So as you consider his legacy and what you might want to do to actually honor that, please take time to consider how you will use your voice and have your say this year. Thank you.